Hey everybody, it's Dr. George Eldayrie, primary care sports medicine physician at Florida Orthopaedic Institute. I'm here with Jason Schoonover, one of our physical therapists. We're going to talk to you guys about some stuff you can do at home to help treat some of the pain that you may be getting in the front of your knees, something we call patellofemoral pain, sometimes often known as runner's knee, or symptoms that you get when you start an exercise program. Since everybody's stuck at home right now, it's a great time to go for a jog, go for a walk, and maybe folks who are not so active want to become more active. This is a common problem that we see in folks who want to go from the couch to their first 5K or their first run, or just getting more active. And if you run into this type of problem, feeling pain in the front of the knee, around the kneecap, try some of these exercises. A lot of times this will make it better. So Jason's going to kind of walk us through some of the things we would have you do in therapy in person, and then these are the same things that we'll recommend in clinic to get things feeling better that you can work on at home. Okay?
All right. So when it comes to the knees, like I explained with most patients, the knee is a really dumb joint. It just likes to flex and extend. The problem with the knee and the dysfunction that occurs there often occurs from up at the hip. So when the hip is weak or tight and has any issues going on, the knee now doesn't just flex and extend, you get some rotation, and that can cause some issues. Short term, like runner's knee, and then long term down the road, like arthritis. So we really address the hips first before we really start to talk about what's going on at the knee. So one of the first things we'll do is we'll have patients lie down here. So doc, go ahead and lie down on your side. And we'll put patients in the fetal position like this. So the feet will stay together. The hips stay stacked on top of one another, because the tendency with this exercise is to want to rock back. So we want to avoid that. And we'll simply do what's called a clamshell exercise. So you can be really flexible at home with this exercise. You can start with no resistance at all, like this, and it's just bringing that giant clam open and closed. Now, if you have any resistance tubing, this would be great to apply and wrap right around the knee, just above it on the thigh, to give you some resistance there. Or if you have a family member that's not doing anything, they can sit here and apply some manual resistance to it too. So that as it comes up, you can apply that. And you should feel that right up here. Usually I tell patients somewhere between the front and the back pocket. Okay?
Right back there.
Yep. Now moving on to the second one in this position, the bottom knee will stay bent. The top leg is going to straighten here. And we usually tell patients keep the angle at 90 degrees. With this, what we want to do is keep the knee straight by tightening the quad. And we're going to extend this leg up and slightly back at a diagonal. Now you don't have to go very high. Technically, all you really have to do is break that horizontal plane. And again, the patient should feel this somewhere between the front and back pocket.
Right about there.
Perfect. All right, so that's going to address what we call the glute medius, muscles on the outside of your hip. That's really important in keeping your pelvis level when you walk and keeping your knees straight when you get up and down out of a chair. Now we're going to come over here. The next set of exercises we can do are in front of a sink, or in front of a counter, kitchen counter. What I like about this sink for this next exercise is it provides something to hold on to. If we're just standing at a flat counter when we do this next exercise, which is a mini squat, and we lose our balance, there's nothing to hold on to. The sink gives us something we can hold on to there. Also, if you don't feel really safe, you can also pull up a chair and put behind you. In case you lose your balance, you always have a protective seat to just sit down into. All right, for this, what we do is we'll have patients with light hand hold. So you're not really gripping it or white knuckling it. Just put your fingers on the inside of the sink. And I tell patients what you want to do is keep the weight in your heels as you do a mini squat. So you're going to squat with your rear end going back, like you're going to sit in a chair but decide to stop before you get there and then come back up. Most patients out there, actually, most people in general, squat incorrectly. They'll squat by moving their knees forward past their toes. So go ahead and try that incorrectly. So when patients go forward, that really puts a lot of weight in the forefoot, in the front of the foot, and it puts a lot of stress on the knees. So as you come back up, when we weight bear through the heels and stick our rear end back, go ahead and do that. That lower leg, if you notice, didn't shear or move forward too much. So it's really getting a good come back up. Good contraction between the quad and the glutes. So you want to feel it in those two areas.
All right. You should feel your weight in your heels when you do that.
Perfect.
You could almost do it almost with your toes in the air a little bit.
Absolutely. And then the next exercise we'll do, you can stand sideways to the kitchen counter with one hand, or if you don't feel really comfortable, you can face the counter and put two hands there. But we're going to do a single leg balance. So we'll face this way first. Light fingertip touch. Usually what I tell patients is pretend like you're laying your fingers on the piano keys, but you're not pressing them to make a sound. All right? And then what we're simply going to do is go ahead and just lift that leg up in the air so it's not touching the ground. And you can put that leg wherever you want. Just don't anchor it to the leg that's on the ground. All right? So what we're really focusing here, again, are the muscles on the outside of the hips. Studies show that this simple exercise is one of the best exercises to recruit the lateral hip muscle that we want to focus on. All right, in doing so, like we said before, we'll keep the legs nice and straight when we're sitting up and down and prevent those knees from diving in, which puts a lot of stress on the knees. So like Doc's doing a great job here, we would hold this with a goal of about 30 seconds, and you can go ahead and stop. So if you make 30 seconds, great. If you don't, obviously we want to work up to that. All right. If you're at 30 seconds and it feels really comfortable, what I would have you do is then turn facing the counter. Let's use both hands right now. Same light fingertip touch. And we'll simply close our eyes when we do it. That's going to add a lot of more difficulty to this, make it a little bit more challenging. Now, not only are we working on muscle strength, we're working on the balance system too, which is always very important for what we do. Okay?
So these exercises are extremely helpful, extremely effective. Keep in mind that a lot of the problems that come from the front of the knee are actually problems that originate from the hips. So you should feel these exercises mostly in the hips. You're going to feel kind of that glute and the buttocks region burning, and that is totally normal and will make things go a lot better. If you guys have any questions, always feel free to call. We're always here, throughout the week to answer questions and get you coordinated with these things. We can even do physical therapy appointments visually now with telehealth. And so we're available for you guys. Our main goal is to keep you active. So let us know. And this is us signing off.